First contact investigation in patients with uveitis. So as we all know, uveitis is not a single entity. It comprises of anterior, intermediate, posterior, and pan-uveitis, and is responsible for approximately 10% of worldwide blindness. The diagnostic workup of uveitis is challenging because of wide range of differential diagnosis, and therefore a tailored approach to the laboratory investigation is the gold standard. So keeping that in mind, we aimed to determine the pattern of investigation in uveitis patients undertaken at first contact, and to categorize these investigations into either tailored or not tailored investigations, and also to determine whether there is any added benefit provided by the investigations versus additional financial burden to the patients. So it was an observational study conducted over a period of 18 months. All consecutive uveitis patients referred to a center were included, with a minimal of 200 uveitis patient as a sample size. We included all age group with a primary diagnosis of uveitis managed initially elsewhere other than our center. The exclusion criteria was those which presented for the first time to our center, and uveitis as a secondary complication. So those patients which presented to our center we took a brief history and examination. We reviewed all the records and investigations, and then based on this standard targeted approach investigation, we categorized it into tailored and not tailored. Approximate amount of investigations was obtained from the patients. So 201 patients were included with a mean age of 35.35 plus minus 14 years. And there was a slight male preponderance. So these were the commonly done investigations in our patients. That was chest X-ray, CBC, Monto and ESR test, which was done in more than 70% of patients. And we could find that around 57.2% patients had investigations done which were not tailored. Also, we could see that the approximate cost in the not tailored investigation group was 3 times higher than that of the tailored investigations, which added to the financial burden to the patient. So as we've seen that these were the commonly done investigations, and we in literature found that the relevance of ESR and CRP in active uveitis patient, which was most of the time normal in active uveitis patient, mostly because it was an idiopathic in origin. But if it was raised, it pointed out towards a systemic involvement. Also, in another paper, it was mentioned that lymphopenia associated with increased ACE contributed more towards sarcoidosis as the diagnosis of uveitis, as opposed to individual investigations. Also, in another study, chest X-ray was found to be abnormal in 15% of patients with active uveitis, and therefore we could say that it is less reliable, and we can therefore plan for a more specific and sensitive test like HRCT chest. This was a study conducted in another Apex Institute, wherein the criteria for uveitis associated with TB was strong bond to positive quantiferon and PCR test. It was found that the quantiferon TB Gold test was banned by WHO, and because of high positivity rate in endemic countries, and therefore it should not be advised to the patients. We found that the mean cost of the investigations in the not tailored group was 3 times higher. A similar thing was observed in another study, which was ULISSE study, wherein the mean cost per patient in the standardized group was lower as compared to the mean cost per patient in the open strategy. So to conclude, not all investigations were tailored. It added to the financial burden and contributed less towards the diagnosis. So always think before diagnosing the investigations and follow a tailored approach. Thank you.
Thank you very much. Thanks for finishing on time.
Yeah. So in how many, if just as an interest, I want to know how many patients were advised HRCT? Like nowadays, a lot of patients are shifting. Did you look at that?
HRCT was advised in 13 patients, ma'am. It was 6.5% patients.
Okay. And did you also look at the yield of these tests, that how many of these tests were positive?
Yes, ma'am. Ma'am, systemic like investigations had contributed to the diagnosis in around 17.8% patients.
Mm-hmm. That's all.
Yes.
Investigations, what is the results of HLA testing?
HLA testing was done in a very less amount, sir. It was done in around 8% patients, and it was not contributing. Most of the time, it was negative.
Okay, thank you.
You mentioned about lymphopenia.
Yes,
Can you define lymphopenia?
So lymphopenia is decrease in the lymphocytic.
Decrease we know, but what is the cutoff value for lymphopenia?
Sir, it is. So I do
That's
not
part
know.
of your study, right?
Yes,
So-
that's true. I'll read about it, sir. I do not know about it.
Okay. So what was the goal of doing this study? Why did you want to do this study?
Sir, it was to find out, like most of us, we advise investigations based, it is a standard protocol that we advise all the investigations in all the uveitis patients. So most of these investigations, they are not tailored as per the presentation of the patient. So we wanted to find out that how prevalent it is, like how frequent we tend to do that.
Okay. And did you read up the ULIS study that you mentioned? Have you read
I
up that
did
paper?
read. Yeah, I read it up, sir. It was basically a randomized control trial. It is the only RCT, I think, which is comparing the standardized strategy versus the open strategy, wherein they had seen whether they have basically randomized the uveitis patients into two categories, wherein in standardized strategy a tailored approach was used, and in open strategy they had there was no a tailored approach used. They basically advised whatever they wanted to advise, and then they basically also calculated the cost aspect of, like, economic aspect of
Thank you.
that.
Thank you very much.
Thank you, sir.
Till the next week.
So our next speaker is